Hello, I am a physical therapist. My name is Reilly Peterson, and today we are going to be talking about constipation and the pelvic floor. So just to get started, I have this model of the pelvic floor here. So these are our hip bones, and then these are our pelvic floor muscles. So in it sits our bladder and then our rectum, and they go nicely in there. Just a little bit about bowel movements. So typically by age 4, they'll have a normal adult frequency of 4 to 9 times a week. However, it can really look different from kid to kid. So with constipation, that happens when the stool is backed up. And so they might have a decrease in frequency. However, kids can also have a normal stool frequency and still be considered constipated. So with constipation, there's usually a couple reasons why it starts and causes. So that might be they are withholding, they have a fear of the toilet, there's lack of access to a bathroom when they have to go. Some medications can cause constipation. Illnesses, being in the bed for like a long time if they're in the hospital for some reason, lack of movement, diet can also cause constipation, and a bunch of other things can cause the initial start of constipation. And then when that happens, the stool comes back up into that rectum, and then it keeps piling back up because eventually the stools will become very hard and hard to defecate. So when that happens, you might get more withholding, and then it kind of just leads to a vicious cycle of withholding and the stool backing up. So constipation symptoms that you might want to look for in your kids is abdominal pain, excessive bloating. They complain about pain when they have to go to the bathroom. You'll see them straining a lot, trying to push things out. They might have a lack of appetite, body odor. Those are just a couple different things that you might notice if your kid is constipated and you're not really sure because they're having normal bowel movement frequencies or stool consistencies as well. So what happens when they become constipated for a long period of time, like 3 to 6 months? So as I kind of showed this model here, so that rectum becomes backed up, and then what can actually happen is it can put pressure on that bladder, leading to urinary incontinence or nighttime wetting. So it can really impact a lot of different things. The other thing that can happen with that backed up stool is the opening of where the stool comes out loses that sensation, so they don't always get that urge to defecate. So you might notice more what we call bypass diarrhea, or fecal smearing. So you might notice some staining in their underwear if they are losing that urge and control over the anal opening. So we want to make sure we address it early on, and that looks like we are looking at their breathing patterns, how their pelvic floor works. Are they able to relax it? What does their diet look like? Are they drinking enough water? Are they eating any foods that would cause increased constipation, like milk or cheese products, things like that? We also want to look at their body position while they're sitting on the toilet. Do they have their hips past 90 degrees? Do they have support under their feet? Are they holding their breath? We want to make sure they are not holding their breath when they're having bowel movements and they're able to breathe. So we use things like bubbles, or I have my kids do mooing noises while sitting on the toilet. Things like that to kind of keep the mouth open as they push, because we don't want to put more strain on the pelvic floor and have them close it off instead of open. So if you think your kid has constipation or are concerned about any type of pelvic floor dysfunction, you can give us a call at 763-450-9400 to make an appointment or ask questions, and we are happy to get back to you. Thank you.